As coronavirus spreads worldwide, some medical equipment is in short supply, even in developed countries. And in some airports, shipments are reported to have been hijacked. So how is that hampering the fight against the pandemic? This is Inside Story. Hello and welcome to the program. I'm Richelle Carey. They cost less than $1, yet masks are so scarce they're being snatched up during the COVID-19 pandemic. But that is not in the developing world, as you might expect. Some of the richest countries are being challenged by a shortage of medical equipment. World powers that are armed for the globe's biggest wars are now fighting for basic protective gear. France is reported to have seized masks meant to be shipped to Spain and Italy. And the U.S. is accused of diverting gear intended for the German police. An estimated 3.5 billion masks are needed by the American healthcare system to fight this outbreak, and there are not enough. And frontline workers risk being infected as doctors and patients are asked to reuse what they have. Countries are rushing to import medical equipment from China, and some are also trying to speed up their own production. But that cannot happen overnight. Many people have been denied masks, like grocery store workers have been forced to improvise. Some are using bandanas or scraps of fabric, and fashion designers, automakers, perfume producers, and others have altered their manufacturing lines to meet this unprecedented demand. Factories that usually make sneakers and iPhones have switched to healthcare products. Let's introduce the panel. In Washington, D.C., Dr. Jehan El-Bayoumi, professor of medicine at the George Washington University School of Medicine. In Abuja, the capital city of Nigeria, Dr. Francis Faduyile, president of the Nigerian Medical Association. And in Leeds, Northern England, Dr. Amir, doctor at the National Health Service in the UK. Welcome to all of you. We really appreciate you joining us for this discussion. Before we get down to the supply or lack of, as it may be, let's talk about specifically masks and PPE. So when we talk about masks, I'll start with you, Dr. Bayoumi. Are all masks created equal?
No, they're not. There are the regular masks that you see people wearing in the streets, sort of out in the public. And then there are what we call N95 masks, which are for the healthcare professionals on the front lines. These are special masks meant to basically filter particles and sort of are an extra level of protection.
Dr. Faduyile, when we talk about PPE, so many lay people have heard these terms now, but Dr. Faduyile, when we talk about PPE, what is this? Is this what any regular doctor or nurse would wear, or is this something that is very specific to dealing with communicable things like coronavirus?
Well, when we talk about PPE are all the things you put on, both from the cap, the goggle, the face mask, the cloth you put on, the gloves, the boot, all of them encompass to be the PPE. And it is usually worn when you are treating cases that are highly contagious. We know that COVID-19 is one of the highly contagious disease, viral illness that is trending, that is in the world now. And for anybody to treat such cases, it is expected that you've done your PPE properly and you get all the PPE, all of them put on, because if you have one that you don't have it fully on, you can expose those health practitioners to contracting the viral illness.
Dr. Khan, so I understand what Dr. Faduyile is saying, that these masks and PPE are important because you are coming in close contact with someone that has coronavirus. But people are showing up at healthcare centers that you don't know whether or not they're infected. So does that mean that staff that maybe don't necessarily wear PPE should be wearing PPE? Should everybody in the hospital, if at all possible, be wearing it?
Yes. So in England, we are now treating every patient who turns up as a potential coronavirus case. there are different levels of PPE, particularly here in the UK. So if you're not doing what we call an aerosol generated procedure, so something that doesn't force air out of the lungs and cause these aerosol particles, droplets that contain the virus, there is a lower level of personal protective equipment required. And that is what we would use for patients, like you say, who might just come in who are unwell, and we expect them because people get unwell with other things. But we will always see patients wearing an apron, gloves, the surgical mask that was being talked about earlier, not the N95 mask, just the routine mask, goggles as well. But if we're doing anything that generates aerosols, that certainly creates these particles containing the virus, then we will go for the full gown and the full mask and visors as well. So yes, to answer your question, we should really be treating all patients, regardless of what they're coming in with, as potential infected cases, because they may have the virus and have no symptoms.
Dr. Bayoumi, there was this period of time where the CDC, and it seemed that a lot of medical professionals were saying just regular people, just civilians, don't necessarily need to wear masks. They may not help. In some situations, they can make things worse. Then now we have the CDC largely telling people, and not just the CDC, medical bodies in a lot of countries saying that when you go outside, try to wear a mask. Why is there a gray area? Is there a consensus on whether or not people should be wearing masks?
Well, remember that this is the novel COVID-19, meaning that we have really very little experience. So as we are acquiring, clinical experience, not just, let's say, in the United States, but from all over the world, we have recognized that this is a highly contagious disease, to the point that when you breathe or have regular conversations, you can contract it. And that's why this physical distancing is so important. Furthermore, it looks like studies have shown that the virus, especially in very dry air, can stay around where you are even after you've left for 20 minutes. So you can imagine that if you're walking by somebody and the virus is in the air for 20 minutes, it really makes sense for everybody to don the mask and the gloves. So that's why it may seem that there's conflicting information, but the reality is I would look at this as updated information. As we get more information, the recommendations and the guidelines change.
Is there any concern that maybe sometimes if people do have a mask, that they may have a false sense of security that I can still go out and about and do everything I regularly should? I mean, is this not a combination of the mask and the social distancing that you just mentioned, Dr. Bayoumi?
It's important to also wear the gloves, because the reality is that we touch surfaces that may be contaminated when we go outside. So the best thing, especially for people that are at high risk, the elderly, people with chronic diseases, people who are immunocompromised, to really stay as close to home as possible and to really minimize going outside. Here in Washington, D.C., for example, we have a curfew at 8 p.m. And although they haven't really sort of clamped down yet and give fines as they have been in other cities, we are expected that to only go to the grocery store or the pharmacy. I, in my car, actually have a special form that I display in my car to say that I'm actually a healthcare professional.
Okay. Dr. Faduyile, what is the status of having enough masks in Nigeria, and what do you know about Africa even broader than that?
Well, the stand about the use of nose mask is still, we are still awaiting the NCDC to give us the directive. As it were, we have stand with the WHO recommendation that says that the mask does not have some major effect in protecting someone. But now that the WHO is reviewing its stand that masks should be used, I think we are going to start that. But one of the major way in which we may not be able to get that is that we don't have enough masks to take care of the population in Nigeria. although we have some local industry coming up with cloth mask or different type of mask, but the Nigerian government has not gone ahead to make it mandatory for every Nigerian to put on mask. We believe that the social distancing is still the best way of preventing the transmission of the disease. However, in other African countries, we have these very low numbers of these consumables, because many of the African countries do not have industries that are producing these very important medical consumables. And because of that, many of the African countries, including Nigeria, depends on importation of the consumables. And we know that in European countries, as well as other developed countries, many of the companies producing these consumables have to take care of the local consumption, which they still have shortfall. So we have China, who has been bringing a lot of consumables for Nigeria and other African countries, and we are hoping that maybe the cloth mask or other forms of masks that we are producing locally, and also, in addition with the social distancing, helps in containing the disease.
Dr. Faduyile, let me get in there for a second. So I understand you're saying the importance of social distancing, absolutely. But if you definitely had enough masks for everybody in Nigeria to wear, would you tell them to wear them?
Well, I think with the rate in which the infection is going, and since the coronavirus is novel and nobody has known the full history or the process of transmission, I would advise that everybody put on the nose mask if it has established and scientific evidence that it will stop and it can stop the transmission of the virus.
Do all healthcare workers in Nigeria have enough? Not even civilians. Do just all of your healthcare workers have the proper equipment they need?
No, I told you that Nigeria and many other African countries depends on importation of these consumables. We have some consumables that can take care of the isolation wards, but the major problem we have is that many of the COVID-19 patients will present at the regular hospitals. And the regular hospitals are also expected to have the N95 and other PPEs ready at their accident and emergency, as well as the emergency medical unit. Unfortunately, we don't have enough to cover the whole place. And that is one of the areas that Nigeria is grappling to be able to protect its health workforce.
Dr. Khan, if there were enough masks to go around for everybody in the UK, would you say absolutely wear a mask?
Yes, I think I would, because as my colleague in Washington was saying, the masks, we're learning new things about this virus all the time. The advice is changing. What the masks do, if you are wearing them outdoors, is stop you from infecting other people with your droplets. So it may not necessarily provide the person wearing the mask with protection, but if everybody wears a mask, they're protecting other people from it. So from their breathing, as we know now, breathing, simply talking can actually produce some of these droplets containing the virus as well. So masks are good for protecting other people. So theoretically, if there are enough masks to go around every single person in the UK, I would say, yes, wear them alongside the social distancing measures. They are far more important.
Dr. Bayoumi, let's talk about the scarcity of these masks, even in the United States. And there's been a lot about, the preparedness of the United States, what was in the stockpile. And there was a stockpile. And from my reading and my research, a lot of the stockpile was used during H1N1, and it was effective, and the response seemed to be on point. And my understanding is that the stockpile hasn't really been built up. What do you know about what the stockpile in the U.S. is supposed to be, and what role it's really supposed to have?
Well, let me sort of break it down and answer your questions in two parts. I have one of my colleagues who is practicing in New York. She's an infectious disease physician. She is obviously in the epicenter where, as you know, hundreds of people are dying daily. She has had to wear a garbage bag to protect herself. And every time she goes and sees a patient in the room, she comes out and she has to clean the garbage bag with bleach. She has been using the same N95 mask for a week and finally had to throw it out. So these are for the healthcare professionals. I think that, the shortage speaks to the fact that there was no real understanding or appreciation for a pandemic that was inevitable. And actually, under the previous administration, there was the pandemic workforce that was really getting ready for this. And as far back as 2014, President Obama was speaking about this and the importance of preparing for this. I think that, how the United States is handling this in general, with the stockpiles specifically, shows the fragmentation of our healthcare system. We really are not integrating public health. Obviously, this crisis has uncovered the incredible disparities. Washington, D.C. is one of the cities in the country which actually has the highest disparities in terms of health outcomes for African Americans versus whites. I think that, frankly, as a physician who has lived here and practiced here and has gotten her education here, this has been an embarrassment. And I think we're in crisis. I think that the administration has been slow to respond and really ramping up the various industries to switch to producing PPE. And so that's sort of my answer. But I wanted to come back to your issue about masks for the public. Remember that you don't have to have the surgical masks. Bandanas, cloth, cotton cloth, scarves that are sort of double layered can be just as effective. I think people sometimes want to go for the masks, and there are shortages of those, and so there are other alternatives.
Dr. Khan, what is your understanding of what the supply of proper PPE is for medical staff at NHS, and then masks for the public as well? What is your understanding on where things stand with that?
Okay, so the official government line is that there is enough PPE to go around all the NHS staff who need it, and the problem is getting it there, so it's logistics rather than supply. From talking to my colleagues all around the UK and on social media, there is definitely an issue with the amount of PPE. People are still having to make their own using plastic bags, as was mentioned earlier there, and reusing PPE and washing it in between patients, that kind of thing, or not even changing it in between patients. So there is really an issue here in the UK. I'm hoping it is just a case of logistics, but I've yet to see evidence of that because it's been a logistical issue now for weeks. So it is a worry when frontline workers like myself, my sister works in the emergency department in a hospital as well, are having to go to work, see patients, which is what we do, and we're happy to do it, but without the necessary PPE that's required. So it is a worry. I'm hoping the government will get it right. In terms of masks for the general public, there isn't a drive here in the UK to get that done yet. Nobody's recommending that here in the UK. Certainly Public Health England isn't recommending that here in the UK yet. It may change in the future, but there is a real push for social distancing and staying indoors.
It certainly seems like planning or lack of planning, and there will definitely be some questions about this, but it seems like lack of planning is obviously how we ended up with this shortage. But also it seems that, and Dr. Faduyile mentioned this, that China produced a lot of these things and imported a lot of it, or exported rather a lot of it to the world. But when they were the first ones to deal with coronavirus, they kept a lot of their own supply, understandably, for their own people. So, Dr. Faduyile, I know you said that you had some things coming from China, but what do you think a lesson might be in this going forward that the world was largely dependent on China for this. What are the lessons from that?
Well, I will say for Africa, it is a lack of preparation that have put us in these major difficulties we have found ourselves. For instance, for Nigeria in particular, we, the health professionals, have been complaining that the amount budgeted for health has been too meager. Whereas African head of states met in 2001 in Abuja, Nigeria, and they agreed that a minimum of 10%, or 15%, I mean, will be budgeted for health so that they can have a sustainable health system. I can tell you Nigeria, since 2001, has not gotten anywhere close to 15%. The highest we have gotten was 6%. And this has put the health sector in perennial underfunding. And because we don't have enough fund in health system, some of the industries that are expected to be servicing the health sector to produce things like masks, things like syringes, things like gloves, are not going to break even if they are produced locally. And this now became very obvious when there is emergency, because even before now, China had locked down due to coronavirus infection that started with them. But now,
Dr. Field, we're just about out of time. I just want to get in one more quick question to Dr. Bayoumi. Do you think that this will be a moment to make leaders wake up about preparedness, about planning? Are you hopeful that that will happen?
Absolutely. I think that the lesson here that we have to learn collectively is that we are interconnected. We are one race, and that's the human race, and that what affects somebody in China affects us here in the United States, affects people in West Africa, in Australia, and that we have to work in a coordinated fashion. And I'll just give the example of the Ebola virus, where you had Dr. Fauci, who, by the way, helped to lead the way to developing a vaccine. You had the international system working with the support of the American administration and the international community at that time. And they quashed the Ebola epidemic and successfully developed a vaccine. That is the approach that we need to talk about and to adopt. Otherwise, we're doomed.
Okay, that will be the final word. Thank you all for joining me. I appreciate it. Dr. Jehan El-Bayoumi, Dr. Francis Faduyile, and Dr. Amir Khan. Thank you. And you can watch the program again anytime. Go to our website, aljazeera.com. For further discussion, go to our Facebook page, facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Richelle, Carey, and the entire team. Bye for now.